Welcome back. Today we're diving into Chapter 11 NBRC style practice questions. Let's start with Section 1, the 4 critical life functions. Question 1. In an emergency situation, which life function should be addressed first? A. Oxygenation, B. Ventilation, C. Circulation, or D. Perfusion. Take a moment to decide. The answer is B. Ventilation. Ventilation is the priority sequence because without moving air into the lungs, oxygen cannot reach the alveoli for gas exchange. Question 2. A patient has a respiratory rate of 28, SpO, 2 of 88%, heart rate of 110, and cool, clammy skin. Which life function is most compromised? Is it A. Ventilation, B. Oxygenation, C. Circulation, or D. Perfusion? Think carefully about the clinical signs. 5 seconds on the clock. The answer is D. Perfusion. Cool, clammy skin is a classic sign of poor tissue perfusion, indicating inadequate delivery of oxygenated blood to tissues. Question 3. Which of the following is true about the 4 critical life functions? A, B, C, or D? Review your definitions. Take a moment to make your choice. The answer is B. Perfusion refers specifically to the delivery of oxygen to tissues at the cellular level. Ventilation is just moving air. Question 4. A patient is apneic but has a SpO2 of 95%. What is the first intervention? A, B, C, or D? Think about the first intervention. The answer is B. Begin bag valve mask ventilation. An apneic patient isn't ventilating. You must move air to remove CO2. Question 5. Which parameter best reflects tissue perfusion? A. SpO2, B. PaO2, C. Lactate level, or D. Cardiac output? Decide which parameter is best. The answer is C. Lactate level. Elevated lactate indicates anaerobic metabolism due to inadequate tissue perfusion. Question 6. A patient has a heart rate of 130, blood pressure 80/50, and urine output of 10 milliliters per hour. What is this consistent with? Is it A. Hypervolemia, B. Hypovolemia, C. Hypertension, or D. Normal findings? Look at the shock indicators. Analyze the shock indicators now. The answer is B. Hypovolemia. Tachycardia, hypotension, and low urine output are hallmark findings of hypovolemic shock and poor perfusion. Question 7. The compensatory response to hypovolemia includes which of the following? A, B, C, or D? What's the body's reaction to low volume? The answer is B. The body compensates for low blood volume by increasing heart rate and constricting peripheral blood vessels. Question 8. Which of the following is not one of the 4 critical life functions? A. Ventilation, B. Oxygenation, C. Metabolism, or D. Circulation? Identify the outlier in the list. The answer is C. Metabolism. The 4 critical life functions are strictly ventilation, oxygenation, circulation, and perfusion. Question 9. A patient is breathing at 8 breaths per minute with a tidal volume of 200 milliliters. What is the calculated minute ventilation? Is it A. 1.6 liters per minute, B. 2.0 liters per minute, C. 16 liters per minute, or D. 160 milliliters per minute? Do the math quickly. Calculate the minute ventilation now. The answer is A. 1.6 liters per minute. 8 times 200 equals 1,600 milliliters, which is 1.6 liters. This is considered critically low ventilation. Question 10. Which assessment finding indicates that oxygenation is compromised? A, B, C, or D? Check the vitals for compromise. The answer is B, SpO, 2 of 85%. This indicates significant hypoxemia and impaired oxygenation. Question 11. The process of loading oxygen molecules onto hemoglobin is called what? Define the process of loading oxygen. The answer is B, oxygenation. This refers specifically to the loading of oxygen onto hemoglobin within the pulmonary capillaries. Question 12. A patient has a cardiac output of 3.5 liters per minute. This most directly affects which life function? Think about the impact of cardiac output. The answer is D, perfusion. Low cardiac output decreases blood delivery to the tissues, thereby reducing overall tissue perfusion. Question 13. Normal urine output should be at least how much? A, B, C, or D? Recall the threshold for adequate perfusion. The answer is C, 0.5 milliliters per kilogram per hour. Anything below this threshold indicates inadequate renal perfusion. Question 14. Which of the following best describes circulation? A, B, C, or D? What is the transport of blood called? The answer is C. Movement of blood through the cardiovascular system. It's the transport of blood throughout the body via the heart and vessels. Question 15. A trauma patient is bleeding profusely. The heart rate increases from 80 to 120 and blood pressure drops. What does this indicate? Assess the stage of shock in this patient. The answer is B. Compensated hypovolemia. Tachycardia combined with falling blood pressure indicates compensatory shock from blood loss. Question 16. A patient who is drowsy but can be awakened with verbal stimuli is best described as what? Choose the correct term for this level of consciousness. The answer is B. Lethargic. Lethargic patients are sleepy but remain arousable with simple verbal stimulation. Question 17. What is the first mental status change typically seen with hypoxemia? A, B, C, or D? Identify the early neurological sign of low oxygen. The answer is C. Restlessness and agitation. Early hypoxemia stimulates the brain and sympathetic nervous system before lethargy develops. Question 18. A patient with a Glasgow Coma Scale score of 7 should be managed with which intervention? Remember the golden rule for GCS and airway protection. The answer is C. Endotracheal intubation. A GCS of 8 or less means the patient cannot protect their airway. GCS less than 8. Intubate. Question 19. Hypercapnia typically causes which progression of mental status changes? A, B, C, or D? Trace the clinical progression of rising CO2 levels. The answer is B. Headache, then confusion, somnolence, and finally coma. Increasing CO2 progressively depresses the central nervous system. Question 20. Which of the following is a critical warning sign in a hypoxic patient? A, B, C, or D? Spot the danger sign in the neurological assessment. The answer is C. The patient becomes restless and agitated. This is often the earliest neurological sign of worsening hypoxemia. Question 21. A semi-comatose patient responds to pain with what? A. Purposeful movement. B. Verbal response. C. Reflex movements only. Or D. No response. What is the level of response to painful stimuli? The answer is C. Reflex movements only. Semi-comatose patients may demonstrate posturing or reflex responses but lack purposeful movement. Question 22. Delirium is characterized by all of the following except identify the incorrect statement. Which of these does not define delirium? The answer is C. Decreased level of consciousness. Delirium causes confusion and disorientation, but doesn't necessarily decrease consciousness. Question 23. A patient with COPD has a PaCO2 of 75 and appears somnolent but is easily arousable. What is the most likely cause? Analyze the blood gas in the patient's state. The answer is B. CO2, narcosis from hypercapnia. Severe hypercapnia depresses central nervous system function, leading to somnolence. Question 24. When assessing mental status, which question best evaluates orientation to time? Pick the right question for orientation. The answer is C. What day is it? Orientation questions should assess person, place, time, and the immediate situation. Question 25. A patient who requires repeated or painful stimulation to awaken is described as what? What's the medical term for this state? The answer is B. Obtunded. Obtunded patients require repeated stimulation and exhibit significantly decreased awareness. Question 26. The Glasgow Coma Scale assesses all of the following except identify the outlier. Which one isn't measured on the GCS scale? The answer is D. Pupillary reaction. The GCS measures only eye-opening, verbal response, and motor response. Pupillary reaction is a separate check. Question 27. A patient with a GCS of 14 is found to have unequal pupils. What is the immediate action? Assess the clinical priority for this finding. The answer is B. Requires immediate neurosurgical consultation. Unequal pupils may indicate increased intracranial pressure or even brain herniation. Question 28. Which of the following mental status changes is most concerning in a patient on a ventilator? Identify the major warning sign for a ventilated patient. The answer is C. The patient was alert yesterday but is now comatose. A sudden neurological decline is always a major warning sign. Question 29. A patient is obtunded, has a respiratory rate of 8, and a PaCO2 of 80. What should the RT do first? Determine the first step for this critical patient. The answer is C. Call the physician to discuss intubation. Severe hypoventilation with hypercapnia requires immediate advanced airway management. Question 30. Which level of consciousness is characterized by minimal response to the environment and decreased awareness? Final mental status check for this section. The answer is B, obtunded. This state is characterized by significantly reduced alertness and minimal responsiveness to the surroundings. Question 31. What is the first step in the physical assessment of the respiratory system? A, B, C, or D? What is the standard order of assessment? The answer is D, inspection. Inspection is always the first step, performed before palpation, percussion, or auscultation. Question 32. Asymmetrical chest excursion most likely indicates which of the following? Analyze the expansion of the chest wall. The answer is B, pneumothorax, atelectasis, or pleural effusion. Unequal chest movement suggests a unilateral lung problem affecting expansion. Question 33. Vesicular breath sounds are characterized by which of these descriptions? Identify the normal lung sound pattern. The answer is B. Vesicular sounds are soft, low-pitched, rustling sounds heard over peripheral lung fields. Question 34. Crackles heard at the end of inspiration suggest which clinical finding? Think about what's happening in the alveoli. The answer is C, fluid in the alveoli. Crackles occur when collapsed or fluid-filled alveoli suddenly open during inspiration. Question 35. Wheezes are most commonly heard during which phase of respiration? Recall the mechanics of airway narrowing. The answer is B, expiration. Airway narrowing becomes more pronounced during expiration, producing the characteristic wheezing sound. Question 36. A dull percussion note during assessment indicates what type of tissue? What does the sound tell you about density? The answer is C, solid or fluid-filled tissue. Dullness occurs over consolidation, atelectasis, tumors, or pleural effusion. Question 37. Stridor is a high-pitched sound heard during inspiration that indicates what? Identify this respiratory emergency based on the high-pitched sound. The answer is B, upper airway obstruction. Stridor is a medical emergency suggesting obstruction of the larynx or trachea. Question 38. The tripod position, leaning forward with hands on knees, suggests what status? Assess the patient's breathing effort. The answer is B, severe respiratory distress. This position maximizes accessory muscle use and improves ventilation. Question 39. Absent breath sounds on one side of the chest may indicate all of the following except? Identify the bilateral lung condition. The answer is D, COPD. COPD causes diminished bilateral sounds, not absent unilateral sounds. Question 40. After bronchial hygiene therapy, which finding indicates the therapy was effective? Look for signs of secretion clearance. The answer is C, clearer breath sounds with more vesicular sounds. Effective secretion mobilization improves aeration. Question 41. How are rhonchi best described during lung auscultation? A, B, C, or D? Describe the sound caused by these secretions. The answer is C, low-pitched, snoring, or gurgling sounds. These are caused by secretions within the large airways. Question 42. Cyanosis is considered which type of sign during a hypoxemia assessment? Identify the timing of this clinical sign. The answer is B, a late sign of hypoxemia. Cyanosis only appears after significant oxygen desaturation has already occurred. Question 43. On palpation, what sensation would you feel if a patient has subcutaneous emphysema? Describe the sensation of trapped air. The answer is B, a crackling or crepitus sensation. This is caused by air becoming trapped under the skin. Question 44. Hyperresonant percussion is typically heard in which conditions? A, B, C, or D? Think about the change in lung density. The answer is C, pneumothorax and emphysema. Excess air in the lungs or pleural space produces this hyperresonant note. Question 45. What is the normal I to E ratio for vesicular breath sounds? A, B, C, or D? Recall the timing of the normal vesicular sound. The answer is C, 3:1. In normal vesicular sounds, inspiration is typically longer and louder than expiration. Question 46. What does a pleural friction rub sound like during auscultation? A, B, C, or D? Describe the friction between these inflamed surfaces. The answer is B, leather rubbing together. This sound is produced by inflamed pleural surfaces rubbing against each other. Question 47. Use of accessory muscles and nasal flaring indicate which clinical status? A, B, C, or D? Identify the respiratory effort level. The answer is C, increased work of breathing. These are classic and critical signs of respiratory distress. Question 48. Tactile fremitus is found to be increased in which of the following conditions? Think about vibration transmission through solid tissue. The answer is C. Consolidation, such as in pneumonia. Solid lung tissue transmits vibrations better than air-filled tissue. Question 49. A patient has wheezes bilaterally that improve after a bronchodilator treatment. What does this indicate? Assess the responsiveness to treatment. The answer is B. Reversible airway obstruction. This responsiveness is characteristic of asthma and bronchospasm. Question 50. After chest physiotherapy, the patient expectorates 30 milliliters of thick, yellow sputum. What does this indicate? Evaluate the therapy's outcome now. The answer is C, a positive sign of secretion mobilization. This indicates that the chest physiotherapy was effective. Question 51. A properly written respiratory care order must include several components. Which of the following is not required? A. Type of treatment. B. Dosage. C. Patient's diagnosis. Or D. Frequency. Think about what's essential in the legal order. The answer is C. Patient's diagnosis. While helpful for context, the diagnosis is not a mandatory component of the actual legal order. The type, dose, frequency, and signature are required. Question 52. If you see an order that reads albuterol nebulizer Q4H, what is missing? A. Frequency. B. Medication dosage. C. Route of administration. Or D. Medication name. Identify the missing clinical link in this order. The answer is B. Medication dosage. The order tells us what and how often, but it doesn't specify the amount of albuterol to be given. Question 53. PRN is a common abbreviation in medical orders. What does it stand for? A. Priority. B. As needed. C. Per protocol. Or D. Post-recovery. Recall the Latin meaning of this frequency. The answer is B. As needed. Derived from the Latin pro renata, it means the treatment is given based on the patient's immediate condition. Question 54. When an order is marked as stat, when should the treatment be administered? A. Next shift. B. Within 1 hour. C. Immediately. Or D. When convenient. Determine the urgency of a stat designation. The answer is C. Immediately. Stat orders are reserved for emergencies where immediate action is required for patient stability. Question 55. In an emergency, which of these can an RT perform without a physician's order? A. Intubation. B. Medication change. C. BVM ventilation and suctioning. Or D. Extubation. What falls within your emergency scope of practice? The answer is C. Perform bag valve mask ventilation and suctioning. These are foundational emergency airway support skills that fall within your immediate responsibilities. Question 56. Protocol-driven care is a cornerstone of modern practice. What does it allow RTs to do? A. Write prescriptions. B. Initiate, modify, or discontinue therapies based on assessment. Or C. Perform surgery. Think about clinical autonomy at the bedside. The answer is B. Protocols empower therapists to make evidence-based decisions without needing a new physician order for every minor change. Question 57. A verbal order given during an emergency is acceptable, but what is the follow-up requirement? A. Signature within 1 hour. B. Signed by the physician within 24 hours. Or C. No signature needed. Recall the legal timeline for authentication. The answer is B. Signed by the physician within 24 hours. Emergency verbal orders must be authenticated to maintain a proper legal record. Question 58. Documentation is essential. Which of these is not required in a standard treatment entry? A. Patient response. B. Patient's social security number. C. Date and time. Or D. RT credentials. What information is irrelevant to clinical documentation? The answer is B. Patient's social security number. Charting focuses on clinical assessment and professional accountability, not sensitive personal identifiers like SSNs. Question 59. You receive an order for albuterol 5 mg Q4H, but the usual dose is 2.5 milligrams. What is your first action? A. Administer it anyway. B. Refuse the treatment. Or C. Clarify the order with the physician. Think about your role as a safety advocate. The answer is C. Clarify the order. As an RT, you are the last line of defense for patient safety. Unusual or potentially unsafe orders must always be double-checked. Question 60. A one-time order is a common occurrence. How is it best described? A recurring treatment. B. A standing order. Or C. a single administration of a treatment or test. Define the frequency of this specific order. The answer is C. One-time orders are performed once for a specific diagnostic or therapeutic need and then discontinued. Question 61. Which of the following is considered a standing order? A stat order, B, a PRN order, or C, albuterol Q4H scheduled. Identify the routine scheduled treatment. The answer is C. Standing orders are routine scheduled treatments that continue until the physician modifies or discontinues them. Question 62. You see an order for chest physiotherapy to all segments, but the patient has rib fractures. What do? A, perform it carefully. B, clarify and suggest alternative therapy. Or C, skip those segments. Assess the risk of further injury. The answer is B. Rib fractures contraindicate percussion. You must clarify the order and suggest a safer alternative like PEP therapy. Question 63. What is the primary purpose of respiratory care documentation? A, to track RT productivity. B, to provide a legal record and communicate patient status. Or C, to organize staff schedules. Think about the legal and clinical importance. The answer is B. Documentation serves as the primary communication tool and remains the official legal record of all care provided. Question 64. If you receive an order that is unclear and potentially harmful, what is your next step? A, do it anyway. B, ask another RT. Or C, clarify with the physician before performing the treatment. Always prioritize patient safety over convenience. The answer is C. You must clarify with the physician. Never perform a treatment if you have safety concerns. Clarification is your professional duty. Question 65. Professional accountability is key. Which credentials should be included in every RT documentation entry? A, initials only. B, RRT or CRT credentials. Or C, department name. Think about vibration transmission through solid tissue. The answer is B. Your credentials identify your licensure and scope of practice, ensuring care is documented by a qualified professional. Question 67. If you see an order for albuterol nebulizer PRN, which required component is missing? A, medication name. B, route. Or C, medication dosage. Recall the essential components of a medical order. The answer is C. The medication dosage must always be specified to ensure the patient receives the correct amount of medication every time. Question 68. The RT scope of practice is well defined. Which of these is not allowed? A, adjusting event per protocol. B, suctioning. Or C, writing independent physician orders. Think about the legal boundaries of your profession. The answer is CRTs cannot independently prescribe or write physician orders. While we implement care, the prescribing authority remains with the physician. Question 69. An order reads albuterol 2.5 milligrams, Q4H and PRN for wheezing. This is an example of what? A, standing order only. B, PRN order only. Or C, both. Analyze the scheduling and frequency of this order. The answer is C. The Q4H component makes it a standing scheduled order, while the PRN allows for extra doses based on clinical need. Question 70. You document that a patient had bronchospasm during a treatment. What is your next mandatory step? A, tell the next shift. Or B, notify the physician and document the notification. Recall the mandatory notification protocol. The answer is B. Any adverse reaction must be reported to the physician immediately and documented for accuracy. Question 66. A protocol allows an RT to discontinue oxygen therapy when A, patient feels better. B, SpO2 is stable on room air. Or C, the shift ends. Identify the objective criteria for discontinuation. The answer is C. Objective protocol criteria guide the decision to discontinue oxygen, primarily when the patient maintains a stable SpO2 on room air. Question 71. A ventilated patient develops increased peak pressure with a normal plateau pressure. What does this indicate? Is it A, decreased compliance, B, ARDS, C, an airway problem like secretions, or D, a pneumothorax? Think about where the resistance is. Analyze the difference between these two pressure measurements. The answer is C, an airway problem. When PIP increases but plateau stays the same, you're looking at an airway resistance issue, like secretions or a mucus plug. Question 72. Now, what if both peak pressure and plateau pressure are increased? A. Airway obstruction. B. A lung or chest wall problem. C. Disconnected circuit. Or D. Normal ventilation. What's affecting the compliance of the lungs? The answer is B. A lung or chest wall problem. When both pressures rise, it suggests a decrease in lung compliance, seen in conditions like ARDS or pulmonary edema. Question 73. When a patient tries to inhale but the ventilator fails to deliver a breath, what is this called? A. Flow asynchrony. B. Trigger asynchrony. Or C. Cycle asynchrony. Identify the timing of the patient-ventilator mismatch. The answer is B. Trigger asynchrony. This occurs when the ventilator fails to recognize the patient's inspiratory effort, often due to sensitivity or auto-PEEP. Question 74. The lung protective ventilation strategy is vital for ARDS. What is the recommended tidal volume? A. 10 to 12 milliliters per kilogram. B. 2 to 4 milliliters per kilogram. Or C. 4 to 8 milliliters per kilogram. What's the safe range for lung protective strategies? The answer is C. 4 to 8 milliliters per kilogram of ideal body weight. Using lower tidal volumes is essential to reduce the risk of volotrauma and barotrauma. Question 75. Plateau pressure is a key monitor in ARDS. To prevent injury, it should be kept below what level? A. 40 centimeters of water. B. 30 centimeters of water. Or C. 20 centimeters of water? Recall the clinical safety threshold for plateau pressure. The answer is B. 30 centimeters of water. Keeping the plateau pressure below 30 is critical to prevent alveolar overdistension and ventilator-induced lung injury. Question 76. To prevent ventilator-associated pneumonia, or VAP, what is the recommended elevation for the head of the bed? A. Flat. B. 10 to 15 degrees. Or C. 30 to 45 degrees. Recall the standard protocol for the VAP prevention bundle. The answer is C. 30 to 45 degrees. Elevating the head of the bed is a simple but effective way to decrease the risk of aspiration and VAP. Question 77. A patient on 60% FiO2 has a PaO2 of 60. What is their P to F ratio? A. 100, B. 200, or C. 300. Perform the calculation. 60 divided by 0.60. The answer is A. 100. A P2F ratio of 100 indicates severe ARDS and a profound gas exchange impairment. Question 79. A ventilated patient has a sudden drop in SpO2, absent breath sounds on the left, and tracheal deviation to the right. What is the diagnosis? A. Atelectasis. B. Tension pneumothorax. Or C. Pleural effusion. Assess the deviation and absence of breath sounds. The answer is B. Left-sided tension pneumothorax. These are classic signs of an emergency requiring immediate needle decompression. Question 80. What is the primary complication of prolonged FiO2 greater than 60%? A. Barotrauma. Or B. Oxygen toxicity. Think about the damage high oxygen causes to tissues. The answer is B. Oxygen toxicity. High concentrations of oxygen for extended periods can damage delicate alveolar tissue. Question 81. On SIMV mode, spontaneous breaths between ventilator cycles are supported by what? A. Controlled pressure. B. Pressure support. Or C. PEEP. Recall the support mechanism for the work of breathing. The answer is B. Pressure support. Adding pressure support during spontaneous breaths helps decrease the patient's work of breathing. Question 82. What is the best clinical maneuver to assess for the presence of auto-PEEP? A. Inspiratory hold. B. End expiratory hold. Or C. Flow increase. Identify the maneuver used to measure trapped pressure. The answer is B. Perform an end expiratory hold. This maneuver closes the valves at the end of exhalation to measure any residual pressure trapped in the lungs. Question 83. A patient has a PaCO2 of 35 on AC mode with a set rate of 12, but is triggering 18 total. What does this suggest? A. Hypoventilation. Or B. Metabolic acidosis with compensation. Evaluate the respiratory drive in this clinical state. The answer is B. The patient is breathing above the set rate, likely to blow off CO2 and compensate for an underlying metabolic acidosis. Question 84. Ventilator-induced diaphragm dysfunction is best prevented by which weaning strategy? A. Sedation. Or B. Daily sedation interruption. Identify the strategy that preserves muscle strength. The answer is B, daily sedation interruption. Allowing spontaneous activity preserves the diaphragm's strength. Question 85. A patient on CPAP-10 has a rate of 28 and is using accessory muscles. What should you suggest? A, increase PEEP, or B, switch to BiPAP for pressure support. Assess the patient's work of breathing on CPAP. The answer is B. Switching to BiPAP provides pressure support, which assists inspiration and decreases the work of breathing. Question 86. What is the ideal I to E ratio for a patient with obstructive lung disease? A, 1 to 2, or B, 1 to 3 up to 1 to 5. Think about the ideal timing for obstructive patients. The answer is B. A longer expiratory time is essential for obstructive patients to prevent air trapping and the development of autopeep. Question 87. A patient has a sudden increase in EtCO2 from 35 to 55. What is the first action? A, settings change, or B, check patient and circuit. Determine the standard first step for troubleshooting. The answer is B. Always assess the patient and equipment before changing ventilator settings or assuming failure. Question 88. Pressure control ventilation is most appropriate for which type of patient? A, post-op only, or B, ARDS or poor lung compliance. Think about the benefits of pressure limiting in this mode. The answer is B. PCV limits peak airway pressure, making it a safer choice for patients with ARDS or very poor lung compliance to reduce barotrauma risk. Question 89. Which set of parameters indicates the best readiness for extubation? A, weak cough, or B, NIF, greater than -20 and strong cough. Think about the strength and protection requirements. The answer is A. Successful extubation requires adequate muscle strength and airway protection. Question 90. A patient on high PEEP becomes hypotensive. What is the most likely physiological cause? A, preload decrease, or B, preload increase. Analyze how intrathoracic pressure affects the vena cava. The answer is B, decreased venous return. High PEEP increases pressure in the thorax, reducing the blood returning to the heart. Let's continue with the next set of questions to test your knowledge. Keep focused as we dive into more high-yield concepts for your exam. Great progress so far. Let's keep this momentum going through the review. That concludes our Chapter 11 masterclass. We've covered critical functions, mental status, assessment, orders, and critical care. Keep studying, and I'll see you in the next review.